Well, welcome everyone to the New World Screwworm webinar for veterinarians and animal health regulatory officials. My name is Stacy Williams. I'm a training specialist with the Professional People Training Staff, known as PPT, in veterinary services. I want to thank our co-organizers and SMEs for their dedication and work in preparing this webinar. And now I'd like to move into the objectives for today's webinar. Upon the conclusion of this webinar, participants will be able to explain the New World screwworm life cycle, clinical signs and morbidity and mortality, summarize the current outbreak and status of New World screwworm infestations in Central America, describe how to detect and report infestations, identify key interventions for eradication, locate specific support resources for responding to New World screwworm. We have a few disclaimers. First and foremost, we want to let you guys know that there are some graphic images posted throughout this webinar, so we just want to make you aware of that. We've also distributed QR codes to aid in providing you with access to supplemental information and references throughout the presentation. So please have your smartphones handy to scan the QR codes as they're presented during the webinar. And we want you to ask clarifying questions in the Q&A panel. This is how we will handle questions throughout the webinar. And we will do our best to answer questions in real time during this event. If we're unable to answer all questions, we will get them answered after the conclusion of the presentation. We have three presenters today. From Veterinary Services Field Operations, we have Dr. Joanna Davis, the State Federal Liaison with the National Veterinary Stockpile. During the 2016-2017 New World Screwworm outbreak in Florida Keys, Dr. Davis served as the liaison officer and in operations on fly release teams. We have from APHIS, Veterinary Services Strategy and Policy, Aquaculture, Swine, Equine, and Poultry Health Center, Dr. Cody Egnar. Dr. Egnar works in the swine commodity team of USDA APHIS Veterinary Services, and his current areas of focus are the National Swine Disease Traceability, New World Screwworm Domestic Action Team, as well as other disease surveillance and response efforts. From the U.S. Food and Drug Administration, we have Tristan Colonius, who serves as the Chief Veterinary Officer as the U.S. Food and Drug Administration in a role he has had since 2023. He joined FDA in 2016 and served in various roles, including as Deputy Chief of Staff to the Commissioner. He's also worked as a U.S. Senate on Public Health and Agricultural Policy and Appropriations for 4 years. And he started his career working in the U.S. Department of Agriculture in North Carolina.
All right, so we're going to go ahead and show kind of a little bit of outline of what we wanted to talk about, share with you today. First of all, kind of an introduction and a biology of New World screwworm. Talk a little bit about the infestations and current outbreak situation. What to see if we report it. What to report if we see it. Where to make those connections. In addition, we're so grateful to have Food and Drug Administration on to talk about some therapeutic options, and we're going to discuss some outreach materials. So we have a great agenda for you today. Really excited for you to be here. So what is New World screwworm? So the Latin name Cochleomya omnivorax. It's a fly, and the omnivorax translates to man-eater, terrifyingly. It causes a condition called myiasis, or an infestation and feeding by a larval fly or a maggot. It only feeds on living tissue of warm-blooded animals. Now, the current outbreak is in Central America and Mexico, but USDA is preparing a domestic response for this strategy. So back in 2024, USDA did an economic impact analysis study. And this is one of the first slides that we'll have of many that has a QR code down here on the bottom left corner. Feel free to go ahead and scan those. And this is a direct link to this economic impact study. Essentially what it studied is if we had 7 million head of cattle at a 20% infestation rate in 1974, what would the economic impact directly be to Texas livestock producers? And then what would it be compared to the economy? So the direct effect is in the dark blue, lighter effect is in the light blue. As we extrapolate that, adjusted for inflation, we can see that there's just under a $700 million impact directly to Texas producers and over $1.8 billion loss to the Texas economy in general. So obviously, a New World screwworm could cause a huge production and economic impact for livestock producers, not just in Texas, but across the United States. Next, I'm going to talk a little bit about the biology of the New World screwworm fly. And the biology is really important in this case because it helps us with later on with Dr. Davis's presentation with eradication efforts. So first we wanted to show you the life cycle. And this is so important for us. I'm going to start right here at the very top in the 12 o'clock position with the adult flies, male and female adult flies. So one of the interesting things about the flies is the female fly will only mate once in her life. And that's one of the key interventions for us stopping the progression of this infestation is that female fly only mating one time. Well, when the wild flies, when they do mate, that female fly, that gravid female fly searches for a wound or an orifice that she can lay her eggs. Again, warm-blooded animals and living tissue. A female can lay about 200 to 300 eggs at one time, but up to 3,000 over her 10 to 30-day lifespan, depending on environmental factors. Now, unfortunately, those eggs hatch in as little as 12 to 24 hours, and they're almost always around the wound or orifice. And that's some of the graphic images that Stacy warned us about. We're going to share some of those images that we have. Those larvae will go through 3 larval stages, L1, L2, L3, in about 5 to 7 day period. Once they reach that 3rd larval stage, they will fall from the ground, from the wound onto the ground, and it buries itself very superficially in the ground where it will go through the pupation period. That will take about 6 to 8 days, and then that adult fly will emerge and start this life cycle all over again. Again, this could be as little as 21 days period of time. Now, fortunately, again, this is very graphic images, so from here on out, we've been warned. The female fly deposits eggs around wounds as small as a tick bite or in even mucous membranes, such as the nose, eyes, ears, anus genitalia, or unfortunately in the umbilicus of neonatal. It feeds on living tissue, and that is really the hallmark of what distinguishes New World screwworm from other myiasis-causing organisms. Unfortunately, multiple infestations in one wound are common. So we don't just have New World screwworm in wounds, you could have other blowfly species. In addition, it's very common to have secondary bacterial infections within these large wound sites. Fortunately, it is not contagious from animal to animal, but any warm-blooded animal may be infested. It's not technically a zoonotic disease, but as it is not transmitted between humans and animals, but humans are at a risk of infestation. So some of the clinical signs of this, the larvae are visible in the wound by about day 3. There may be hundreds present in this wound site. And as you can see in the cervical area of a dog, we have right here, so the ears of the dog are here, towards the left is the head, the cervical area, dorsal cervical area, and then the shoulders back here. You can see the vertical orientation of the New World screwworm larvae and just the diffuse nature of this infestation. There's hundreds, sometimes thousands of larvae present. These larvae could be up to 17 millimeters or just over a ½ inch long. It almost always causes bloody discharge, can have a foul odor, but you unfortunately may only see a very small wound on the surface, but it's deep infestation underneath the skin. Unfortunately, some of the signs we may only see is just have an animal being depressed, off feed, or separating itself from the rest of the herd, or head shaking. Now, morbidity varies between regions, but it can reach nearly about 100% in favorable environments. In some areas, the navel of almost every newborn animal can be infected, but it obviously varies with conditions, age, organs infected. Animals can become systemically ill from secondary bacterial infections, but treatment with parasiticides can be successful when detected early. Unfortunately, if left untreated, mortality is usually fatal within 7 to 14 days. Now, nearly 100% of newborns in an unfavorable environment can have 100% mortality, usually through that invasion through the umbilicus area. So now I'm going to show you some images of some screwworm infestations. This image right here is the image of a deer laying down. This is obviously ears, cervical area, and a large wound, a large laceration right here. You can see how these flies really can be pretty aggressive when it comes to swarming a wound and laying those eggs around here. We can see multiple flies, adult flies, swarming this wound. Now, as that disease or that wound progresses, you see obviously a necrotic area around the surface of the wound, and then right here we have these egg packets. Again, she can lay about 200 to 300 per female fly at a time, and they try to lay those on the surface. Once they start the larval period, they invade down into the deeper part of this wound, and they go through the 3 larval stages, and then they start to emerge. You can see adult female fly here and some maggots and larvae, probably 3rd stage, starting to emerge. So this is another deer, and we can see the severe maggot infestation and flies swarming around and laying eggs. So we have multiple levels of infection here. We have infestation, excuse me. We have some eggs here, the adult female flies up here and at the base of the ear. And then if you can put on your imaginoscope down deep in this, you can see the larvae, the further progressed larvae down deep in that wound. What's not so evident in this is the severe infestation, and it's hard to appreciate in this picture, but there's a very large wound area here that's kind of protruding out. And that's very characteristic of a lot of these infections. There's so many larvae in this site, it makes it really hard to see because the wound itself can be so small. Now, as the disease progresses, we can see invasion of tissues until that animal passes away. This is obviously a deer, probably a key deer here. There's an eyeball and the base of an antler here. You can see adult maggots here, one trying to take off right there. It's really hard to see in this picture, but as these larvae really start to invade, they're invading down the cervical area of the neck of this deer here. And they did feed into the skull and the brain tissue of this animal, unfortunately. Here's a picture of a chicken, kind of the south end of the chicken here. You see there's now infestation of chickens is uncommon, but they do infect any warm-blooded animals. So you can see here any type of wound or any orifice and enough opportunity for this female screwworm to lay eggs, she will lay eggs and cause an infestation. And unfortunately in pigs, it's kind of the same. This is kind of shocking as far as the subtle nature of this infestation, where this pig was inspected and you can see wound opening here and here, but you see really the lower lip of this pig is really edematous, really swollen, has a lot of blood. I could imagine how foul the odor would be, but just kind of highlights the subtle nature of some of these infestations. Not really evident that there's flies or larvae coming about, just that we know that this was infestation. In addition, domestic animals are also at risk for infestation. This is a feral cat that was trapped and euthanized for myiasis. You can see, not a great picture here, but you can see some maggots down in the ear canal of this cat. So in Panama, COPEG, and we'll talk a little bit more about what COPEG is here in a minute. COPEG did a study and they looked at the top 10 conditions leading to myiasis. Some of these are naturally occurring, but others are part of husbandry practices. And that's what a little bit we wanted to highlight with this. So the number one condition that they noted was the umbilical infection. So as stated earlier, that female fly will get around the umbilical animal of a neonatal calf, and it will invade into the abdomen there. They also saw a lot of infestation with cuts, vampire bat bites. So the vampire bat would bite, and then the female would come lay eggs there. Sting, wire cuts, with use of barbed wire, ear tagging, dehorning, dog bites, peeling, maybe say from a sunburn or even as small as a tick bite. And this is data to show how little it takes for these screwworms and how aggressive they are when it comes to infesting wounds. All right, so we're going to go on just a little bit further, then I'll turn it over to Dr. Davis. We're going to talk about the distribution and the current outbreak of New World screwworm. So unfortunately, the United States has had New World screwworm. We began eradication efforts in the 50s and 60s in the southern part of the United States. It began in the southeastern part of the United States in 1957 through 59. There's a large eradication effort to be able to push these flies out of the South. That continued in the southwestern from Louisiana to California in the 60s to eradicate the fly from there. And I remember on our ranch in Arizona, my grandpa talking about them dropping these boxes out of planes that Dr. Davis is going to talk about. Then in the 70s and 80s, we began cooperative work and great collaboration with Mexico, and starting in about 1972 to push it all out of Mexico. Beginning in the northern part, obviously the border, and then 1981, 82, 83, 84. And finally, we got to the Darien Gap down here in the southern part of Panama. Now, the Darien Gap is the narrowest point between North and South America, which makes the ideal location to establish a barrier. In 1994, COPEG, or the Panama United States Commission for the Eradication and Prevention of Screwworm, was established to maintain that barrier. Now, unfortunately, as you can see here, that in July 2023, that fly started to escape the barrier, and it moved from the Darien Gap down here in the bottom right of your screen through Panama, Costa Rica, Nicaragua, Honduras, El Salvador, Guatemala, and now it's made it up past the isthmus here in southern Mexico. And that's where a lot of the efforts that Dr. Davis is going to talk about have resulted in the USDA and Mexico collaboration response. The northernmost detection is here, this one detection that was in July in the state of Veracruz. But since then, we haven't had any further detections north. So the USDA, on June 18th, Secretary Rollins announced a 5-pronged plan for USDA to address the New World screwworm approach in Mexico. This plan involved 5 key points. First, stop the pest from spreading in Mexico. Second, protect the U.S. border at all costs. 3, to maximize our readiness. 4, to take the fight to the screwworm. And 5, innovate our way to continued success. After that, 4 listening sessions from the end of June to the first part of July were held, and those were to gather feedback on New World screwworm technologies and tools. And with that, I'm going to turn the time over to Dr. Davis to talk about the rest of this presentation and our response efforts from the USDA perspective. Go ahead, Dr. Davis.
Right, thank you. Let me get my slides pulled up here. All right, is everyone able to see the slide?
Looks really good, Dr. Davis.
All right, so just a couple of things that I really want to stress on this slide. As we said kind of in the pre-test question, is that this is absolutely preventable. We're very nervous about it coming to the United States, but we're doing everything we can to try and prevent that from coming to the United States. So this is going to take a huge effort on everyone's part, but the way is kind of like 3 legs to a stool. We would be able to use the sterile insect technique. We'll have robust regulatory and movement controls for animals, and then really doing really a lot of outreach, a lot of surveillance, a lot of stakeholder engagement, so that if we were to get any New World screwworm flies in the United States, first of all, that if we got it here, that we would be able to identify it quickly, send it to the lab, the veterinarian is able to treat it promptly, and that we can really minimize the spread as much as possible. So those are the 3 parts that I really hope that you'll take away, that it would be the 3 things to prevent it or to treat it if it gets here: is the sterile insect technique, regulatory controls, and then field surveillance and stakeholder engagement. Those are the big topics that we want to do here. So with our sterile insect technique, so far we have had In North America and Central America, Copeg down in Panama, as Cody showed on the slides, that has been where for decades now, that has been our only fly rearing facility in North and Central America. In 2023, when this outbreak kind of pushed past the border, Panama and the Darien Gap, and we really started to have that influx of cases in Panama in humans and in animals, and then they started to move through Central America and now in Mexico. One of the things that the Secretary has really pushed in this five-prong approach is that we're going to take this fight to the screwworm. One of the ways that we're doing that is having a dispersal facility in South Texas that we're working now to try and get that set up. Hopefully it will be operational by the end of 2025. We've got that plan. We already have a facility in place producing our own flies. There are lots of people in leadership talking about how we can get that done. So that is very active and ongoing discussion right now. The other part of this is challenging the concept that sterile insect techniques are the only solution to eradicating it. That is a piece of the puzzle, but that's not the only way that we do it. Just as important are the regulatory controls of both people and animals. That's how a lot of it spread through Central America and then up into Mexico, is people moving their animals when they shouldn't be, and then that fly gets established in another area where it had not been before. If they're moving to livestock markets, or if they're moving to a different state in one of those countries and those animals have not been inspected before leaving that farm, they could potentially be spreading New World screwworm flies or maggots that way, because they can certainly travel with the animal. Humans have done this as well, and so we have lots of cases throughout Central America and Mexico where this is how New World screw has spread so much, is animals moving when they should not have been moving. We need to have really, really tight controls. Make sure that when an animal leaves your farm that you take a good look at it, make sure that you don't see any signs of infestation. Make sure that you see that the animals are healthy. Check your young animals before you have to move them anywhere. It's just going to be, we're all going to have to be very, very diligent in how we manage our animals until we know that this threat is kind of reduced again. So that's going to be very important. In states, enhancing your quarantine practices, ensuring that any animals that are quarantined, that there are regulatory controls to ensure that people follow those quarantine regulations, and then even having animal control and inspection checkpoints. We do that at our border anyway, and they're doing that in Mexico. They're doing that in other countries, that as animals or their animals on the conveyances, if they're leaving those areas, that those animals are being inspected to ensure that they don't see anything. They're not always easy to find. They may be on a very, very small wound. As Dr. Egner pointed out, there are many different ways that an animal could attract that female fly. She is the one that lays the eggs, that develops the maggots. It can be something as small as a tick bite. That's what could attract her. It could be a very, very small cut or wound. You want to look in the axilla, in the groin, try and look in the ear. So you want to be very, very diligent about how you're inspecting these animals before moving them off of their farm, or if they're coming onto your farm, ensuring that they don't have anything before you introduce that animal to your farm. Livestock markets, it'll be the same thing. In your veterinary practices, especially. If an animal is supposed to be going overseas, then in many of those cases, you'll want to make sure that they don't have any potential wounds that are on there. If they are coming back from another country and someone is complaining that their animal has not been feeling well, if they have wounds that they see, or if they say that they're seeing maggots, be very diligent in your questioning of that client to find out if they have been anywhere, if the animal traveled with them, so that we can identify where these potential infestations have come from. In our field surveillance and stakeholder engagement, we are already busy at work in doing that. That's what these webinars for these next couple of days are for, is to try and reach out to as many people as possible to educate the public about New World screwworm, how we can prevent it, how we can manage it if we do get it here, to try and minimize its impact. So very important to that, your animal care and husbandry practices, your breeding practices, just keep in mind the things that would attract that female fly. You want to try and mitigate that as much as possible. We've got some slides coming up here, but consider times that you're doing dehorning or castration after your animal gives birth, really no matter the species. If they are outdoors, be very vigilant and check them pretty much daily to try and make sure that we're not getting any of this population established, you'll see, or you could see the eggs before you would ever see the maggots in the wound. So if you say those little pieces of rice that were shown in that picture, that's your first clue that the female has laid those eggs at the margin of a wound, or kind of at an opening to the nose or around the eyes, in the ears. So that's why we want to have a lot of these pictures to show you, so that in inspecting your own animals or any of your clients' animals, that you can look for these potential signs of New World screwworm laying her eggs. The treatment of wounds and having appropriate veterinary care and supplies. As Dr. Egner mentioned, we do have FDA on. They're going to talk about potential therapeutic treatments or therapeutic options for animals that have New World screwworm myiasis. But what's also important too is not only trying to treat the maggot or treat the egg, what we're trying to do there. In some cases, after several days, depending on how deep some of these wounds are, those animals can become really systemically ill. And we want to provide supportive care to those animals as well. We can kill the maggots, but if that animal is already developing secondary bacterial infections, if they're dehydrated from this, veterinarians are going to need to provide that supportive care as well. So just be, just paying attention for that. If someone calls you on the phone, says they see maggots and they're just laying around, be sure if that animal needs any further veterinary care or not. In some of those cases, you may see flies like this swarming around. I just want to stress, you cannot definitively identify a New World screwworm fly only by looking at it like we're looking at it right here. You can't look at a wound and tell. We recommend collecting some of those flies. We've got some information here on submission, but collecting those flies, if you see them, you can catch live flies, believe it or not, but you can put them in a tube and submit them as well, and we can identify those particular flies. They're very distinct. They kind of have this shiny blue-green, they have big orange eyes, but they're not the only species that look that way as well. In strengthening our field surveillance for New World screwworm activities, recently we have done a lot of work at our southern border. We have partnered with Texas, with California, Arizona, New Mexico, and California, New Mexico, Arizona, and Texas. And we're really kind of upping our surveillance at the border, working with our partners there so that we can try and secure our border at all costs, like the Secretary said, and identify any of these flies before they have a chance to get a foothold in our animal population. The border is very important, but keep in mind too, animals travel, people travel. So the border is number one, but they can travel by air as well. We have certainly over the years have animals that have come in to different airports, and every now and then we will have a domestic pet, or say a horse that's come from another country, and they're identified as having had New World screwworm because they didn't come through the border, they came through an airport or say on a cruise ship or something like that. So getting a really good history is going to be critical. Outreach and education, that's a lot of what we're going to provide you guys today. This should be kind of a primarily veterinary audience. We had kind of the veterinary animal health official today, producers tomorrow, but this is really essentially the same, and that we want everybody to have as much information as possible so that you can learn what screwworms are, learn how to identify it if you see them, know what to do, where to report it, how to submit samples, what to do to support that animal, and then how to try and contain that as much as possible through animal controls. And then also another part of that field surveillance is expanding our laboratory capacity for New World screwworm identification. For a lot of the things we're doing now, as you can imagine, we could get thousands of flies any day in our traps. And so we want to be able to expand that capacity where we can, but then still ensuring that we have good quality control on that too. So that's part of our outreach and engagement as well. At our sterifly production and dispersal facility in Panama. So this is very interesting down there. So as you guys saw from that previous slide, it took about 44 years from the time we started trying to eradicate it in the late 1950s in the deep southeast in Florida, Georgia, Alabama, and then we pushed it west, and then we kept pushing it further and further south through the Darien Gap at Panama. That took 44 years to do that. So that's why we want to be very, very diligent about our management practices, what we notice, movement controls, because we don't want to spend decades trying to eradicate this again. It's been done before. We can do it again if it gets here, but we want to minimize it. So this sterifly production facility down in Panama, so this is where they raise flies. They feed them. You can see right there, the guys that are working down there in the bottom left-hand corner, this is the kind of slurry, I believe that this is liver, that the maggots feed on. And so that kind of grows the maggots. Then the next stage in that is they become pupa. Here in your top right-hand picture there, those little black things that look like perhaps wild rice, those are the pupa. That's what we really want to prevent the wildflies from getting into the ground, because that's going to perpetuate. But this is where I mentioned that we use the biology of the flies against them. The females mate only one time in their life. So by sterilizing these male screwworms, we can release them into the environment. They mate with the wild females. Then when that female breeds the one time, she may lay eggs, but they will be sterile eggs and they will never develop into maggots. And so this kind of technology was developed to attack the fruit fly many, many decades ago, and they use the same technology. And so right now what they use is a radiation to, and that is what makes the gonads unable to produce sperm so that they can make fertile eggs with the female. And so right now, that's the only, like I mentioned, only place in North and Central America that has it. And so they produce probably hundreds of millions. Yep, we've got that right there. We've got 100 million or so pupa a week, and then they are packaged up. Right now, many of these are going out through Mexico, and they are put out through airdrops. The other options that we have in some cases, like in 2016 with New World Screwworm in the Florida Keys, we use ground dispersal chambers, and then they hatch out as the day gets warmer. They hatch out from pupa to fly. The males go and look for females and breed them. And after you go through several life cycles of this, that's when we can eradicate it, because we want to get a certain proportion of males to female in the environment based on the information we get from our surveillance. And then we release those flies, whether by air or whether through the ground chamber. And at some point, knowing that the life cycle can be 21 to 30 days, then we get to a point where all of the females, all of the eggs that they lay will be sterile, and that's how we eradicate it. So it takes time, but we know that this is able to work. There's a lot of research going on right now about better ways to sterilize these flies. But right now, anything that we use, it's harmless to humans. These guys work down there. You know, this has been used, like I said, for decades across many countries, and it's safe for humans. When these flies go out in there, they hatch out, they're adult flies, and they live their typical life, their life cycle with no problems after that. They're just sterile. So each week in Panama, they can produce around 100 million pupa. That's about the maximum capacity, kind of depending on several factors. Week to week, it could be 99 million, it could be 105 million. So, but that's kind of the general capacity down there at COPEG. And those dispersal flights right now are conducted each week. When we use this sterile insect technique, we need to go to our northernmost area that we know that we have an infestation, and then we coat that area, and then we keep pushing it further and further south, because what the ultimate goal is to get this back below the Darien Gap. It is endemic in South America, but we have this facility, and we've done this, like I said, for years. And so the goal in doing all of this is to push it back south of Panama. And so these dispersal operations, we're going to look at shifting them to North America to stop the spread and then reestablish that biological barrier, as I mentioned. Like I said, we are actively working on getting this dispersal facility stood up in South Texas. So that's still several months away. A lot of this, you know, it takes time, it takes personnel, but that is what we're actively working on right now, to stand up this dispersal facility in South Texas. And then as far as creating our own fly production center here, we're helping Texas with theirs. We have given the Mexican government, I think, about $21 million to kind of revamp the facility that they have. And then ultimately, we're talking about how we get one built here. And this is just a little bit more information on COPEG. The Commission for the Eradication and Prevention of Screwworm is a partnership between USDA, specifically ARS, Agriculture Research Service, and then the Panamanian Department of Agriculture. And so you see the entire facility right there. That's where everything happens. That's where they raise the pupa. That's where they pack everything up. And then they move it really now throughout Central America, now into Mexico. And it employs about 570 Panamanian nationals. So you can kind of extrapolate that. If we have this here in the United States, we would also need hundreds of people, even potentially hundreds of people, even just for the dispersal facility. This was actually inaugurated in 2006, and it has outposts throughout Panama and 6 other movement control posts. So we have entomologists, we have GIS specialists, epidemiologists, that each time something is found, each time there's a new infestation, they look at all of these different scientific data points to determine the best path if they're doing aerial flights, or if we need to do ground chambers, where to put those. So we have a huge team of scientists behind us that know where to put these pupa to get the most bang for our buck, so to speak. And we do have a dispersal. I think that's the most current for us. So just a couple of things on the importation of animals from Mexico. So as of July 9th, USDA suspended the importation of live cattle, horses, and bison through our southern border. And this had to do with, that was right after that last detection, kind of that northernmost detection that I just showed you in that slide. We had reopened the border, or had plans to reopen the border kind of in a phased process. But then we had this northernmost, and we just said that, you know what, we just need to really kind of mitigate our risk as much as possible. So the secretary, she advised that we close down this border again, because we don't want to risk any animals coming through that perhaps we miss. We're doing everything we can to stop it at the border, but right now it's just kind of risky. So right now, all of those imports have been suspended. And so Seneseca, which is kind of our equivalent to USDA in Mexico, reported the most current case on July the 8th. And as I mentioned, it's 160 miles north of where the last sterile dispersal grid was located. So it jumped pretty far just in a few weeks' time. So we just want to be very vigilant in keeping it out that way. For any dogs that are coming in from Mexico, they are eligible to come in the United States, but they must have a valid import health certificate from Mexico, and they have to have been inspected within 5 days of coming into the United States, and they have to have been certified free or been treated or quarantined, then determined to be free for any kind of New World screwworm infestation. So there's documentation that needs to go with that. So they can come in, but they have very tight protocols that they need to go through before they come into the United States. And just in speaking about outreach and education, some of you may have seen this so far, but on our USDA APHIS veterinary services side, we come out with different FAD prep documents. That's foreign animal disease preparedness documents. This is kind of what we do in large part, is trying to keep foreign animal diseases out, of which screwworm is one of those, even though it's a fly. And so we have updated our response policy in what's called the Green Book. This was updated just in June 2025. The previous version was in 2018, following our last New World screwworm outbreak in the Florida Keys. So this is updated just as a couple of months ago. And this is really a little bit higher level, focusing on the historical and general overview of New World screwworm response and strategy. So this will kind of give you the big picture or an outline. And then the playbook that's currently in development, that's something else that we're working on right now. There's several different groups working on it, and that'll be topical, and all the different parts that would go into an actual screw response, about communication, outreach, resources that are needed, how we would get these flies in, the surveillance, all of those different pieces will go into this playbook. And that's really going to focus on farm animals and wildlife, giving an operational plan for implementing our New World screwworm response, should we get it in here. And as we're finishing up these draft documents, we're getting input from state animal health officials and industry so that we can incorporate that as well. Because we really want to have this be a complete approach, and having all of our stakeholders with input to put this out. And if I didn't mention before, I'm trying to catch up on acronyms in case I see them anywhere, but SAHO, that state animal health official, or in many cases, a state veterinarian. So I'll try and catch myself if I see any acronyms. So now our next section is, what happens if you actually see screwworm? What do you do at this point? So if you see it enter on your animals or on your patients, there are several steps that you can take. If you are an animal owner or producer, you need to immediately contact your own veterinarian, the state veterinarian, or the USDA office, extension agent, any of these regulatory officials. They can guide you on what to do for, getting the animal treated. That would be your private veterinarian. And then your state regulatory officials, your state veterinarian, USDA offices can advise you on how to collect samples, and then how to submit those as well. And then again, our state regulatory officials can guide veterinarians on how to do this as well. Get treatment for your animals as soon as possible. Like we've said, animals can be treated successfully. Sometimes it just may be something as simple as applying some kind of pesticide, or antiparasitic medications. In some cases, they may need that extra supportive care, but veterinarians work with their clients on that one. We advise don't move your animal anywhere except to your veterinarian to get treated, because we don't want to risk the chance that any flies could get there or that maggots could potentially fall out. When those maggots, after they're done feeding, then they would fall off the animal. They can get into the soil, but they can also do that in bedding if you're taking your animal on a trailer. So ensure that anywhere that animal has been, if you've moved it anywhere, that your conveyances need to be sprayed down well with pesticide as well. We just want to do everything we can to minimize the risk of spread of these flies or the maggots. Keep your animal in a safe or contained space. Try and minimize exposure to other animals as much as you're able to. It's hard if you've got a herd of cattle or many horses that are outside. It's kind of tough to do that. If you've got small animals, that may be easier to keep them inside to minimize the risk while those screwworms are dying off. Spraying down potentially infested areas like the trailer that I mentioned, any kind of bedding, spraying those down with pesticides or insect sprays. Was really early 2017. The only animal that we had positive for New World Screwworm on the Florida mainland was a stray dog down in the southern tip of Florida. And that one, the reason that they noticed that it was a stray dog, so it was not in great health anyway, but that's what they noticed, is that in the bedding, that's where they noticed, I can't remember now if it was either fly or maggots or maybe both, but that's where they did it. So we know that the different life cycles that can fall off in the animal bedding. So just be very vigilant about that, especially as you're treating your animal. As soon as those medications start working, you can have the maggots start to fall off. So it's probably not a bad idea for the veterinarians to try and clean those out and collect them as much as possible to minimize the chance of spread too. Collect any samples that may look like maggots into a container. We'll talk more details about that in just a minute, and save those in rubbing alcohol. That's what we really prefer to get those samples in. And then wear gloves just to protect yourself. For producers, if we've got producers on here today, have your veterinarian visit your farm or find a veterinarian. Consider your husbandry practices and then timelines for recovery. Do you need to kind of shift when some of those things are done? Ensuring that you've got fly sprays to apply. The New World Screwworm fly, it is very susceptible to cold weather. And so in some cases, maybe you're able to kind of push it off to when it's colder outside. They really like warm, humid weather. So just kind of adjusting your husbandry practices. It was said in one of our previous listening sessions for New World Screwworm hosted by the Secretary's office. Remember, there was a speaker that was on there that, she remembered when, I believe it was her dad, when they had screwworms in Texas. And he said, you had to learn to be a really good cowboy. And so that's kind of what we're going to look for in this, is that everybody just needs to be a good cowboy, cowgirl, being very vigilant about inspecting your animals regularly for signs of New World Screwworm. Consider potential fly control options for your premise or your farm, and then establishing the clear movement biosecurity controls and practices. So we're used to talking about biosecurity for other diseases. In New World Screwworm, it looks a little bit different. A main part of that is implementing some kind of good fly control measures. As we mentioned, adjusting management practices. The PPE that we talk about for other diseases, it could be something as simple as just using gloves when you're treating infested animals for this. It's not really required to have Tyvek or anything like that. But if you should happen to have any wounds, just avoid having any kind of contact, because you don't want to attract those female flies to lay eggs if you happen to have a wound open either. If you're an awake and alert adult, it's pretty rare for adults to get it. Understand and follow your movement control guidance to prevent further spread. And we talked about inspecting animals, leaving and entering farms, and just being very vigilant. And then check our website regularly, because as more information comes out, we'll continue posting that on our site. Now, I think today is mostly veterinarians and animal health officials, but if someone needs to find an accredited veterinarian and they don't have one, this is the site that we have. We've got the QR code there if anybody wants to take that picture. And so clients can find veterinarians this way. That QR code opens up to this screen where someone can select the state, the county they're in, which category of animals. We have category 1, category 2. It gives a description of those, and then what species. And so that's a way. And then if they go through that, then there's a list below that lists the veterinarians and their contact information. And that's for accredited veterinarians. So for vets, a couple of things that we want to really stress for you guys is have those patient-client relationships so that you can advise people, encourage them to implement lower risk husbandry practices, review fly prevention and control, wound treatment and management. But remember your withdrawal times. We've got FDA coming up here in just a minute. Know what your practices are for certificates of veterinary inspection if animals need to go anywhere. And then just reviewing a lot of this with clients. I think this is a good opportunity to do outreach with your clients as well to help them prevent New World screwworms as well. So at the very end, we're going to have some outreach materials to help you with that too. So for our veterinarians that are on here, private practitioners, what happens when you don't report a reportable disease? As an accredited veterinarian, you have to maintain a knowledge of reportable and potential foreign animal diseases. As an accredited vet, you are considered a regulatory animal health official and reporting to your state veterinarian or your APHIS veterinarian in charge per the 9 Code of Federal Regulations. But if you're not accredited, you should still know those triggers for an unusual disease presentation or event. Everyone has a responsibility to report it. Statutorily, accredited vets have that responsibility, but really for the good of all, anyone should report anything that's suspicious here. So in 2016, the outbreak down there in the Florida Keys among the key deer, it did not get reported or noted for a few months before we were able to identify it. And so in that case, we lost 20% of an endangered species, cost taxpayers millions of dollars for the response efforts. We had unnecessary animal suffering and death and potential risks to human health down there too. We worked with our local public health on that response. Thankfully, I don't think that we had any humans that were identified as having had it down there. But once we were able to respond and starting the sterile insect technique, we did not have really, there's hardly any livestock down in the Florida Keys. If y'all have not been down there, we had a few pets that were down there, and it was just really isolated to a few keys or islands down there through that chain of Florida Keys. And so we implemented the sterile insect technique, put out ground chambers, and just to kind of give you reference. So it was in pretty much just one species, and white-tailed deer. Very few pets, very little livestock in that area, just a few keys. We did ground release chambers there just because there was so much water in the wind that we felt like it was a better use of those sterilized insects to put out the ground chambers. They would hatch out, they would breed with the females. So just to give you context, that took a little over 6 months and millions of dollars just to eradicate it from that kind of small outbreak. So it is very, very, very important that veterinarians know what's reportable and to whom it's reported. Wildlife can play a huge role in disease outbreaks. Failure to report the diseases or symptoms can cause a vet to lose their accreditation as well. Veterinarians cannot sign certificates of veterinary inspections or health certificates if they're not accredited. So if you're unsure if you're accredited or if you're unsure if your accreditation has lapsed, you can use this QR code right here. It goes straight to our National Veterinary Accreditation page, and you can check your accreditation status there. If you want to become accredited and you're not, it also guides you on how to do that. And this is just the 9 CFR Code of Federal Regulations, the standards and duties for accredited vets. And it's to report all suspected cases of communicable animal diseases, diagnosed or suspected, that is not known to exist in the United States. So I don't think, Cody, I mentioned this. We do not have this in the United States right now. We don't have screwworm in the United States. We've not found flies. We have not found maggots in animals in the U.S. But you don't have to have a definitive diagnosis to report it. If you suspect it, report it. And very specifically, it goes into all of the diseases and screwworms right here on this slide. And so who can report suspicious cases? Veterinarians, but it can also be meat inspection, slaughter plants, livestock and poultry producers, diagnostic laboratories. That's how we found out about it in Florida. Extension agents, pet owners, anyone can report these suspicious cases. And they can do that by contacting either their USDA area veterinarian in charge or their state animal health official. And then we'll just talk real briefly about how to collect and submit New World screwworm specimens. And if there's anything on here that y'all wanted to go back, we are gonna, I know Stacy mentioned that we are recording this and we'll make this available too. Our last section of this will be a lot of outreach. And so we'll have a lot of QR codes for that, for our publicly facing pages where you can go back and get information as well. So if you feel like you don't have all the details from that, we can certainly help you out in other ways, whether it's through this webinar or reaching out to your state vet or ABIC. So in collecting and submitting samples for New World screwworm, as I mentioned, always contact your state animal health official or your ABIC, and they will get a foreign animal disease investigation number, and they will coordinate the submission of your samples. What's very important is that each animal gets their own labeled vial so that we know you can have multiple infestations of maggots on a farm. You can have some screwworm, you can have other species as well. But submit what you can get. Eggs, larvae, maggots. If you get maggots, it's a good idea to get them in various shapes and sizes. It might sound weird, but get them at different depths of the wound if you can, because we can have different life stages of maggots. They go through 3 different stages, and that helps us in aging about how long that maggot has been in there, because that helps determine kind of how long ago that animal could have been exposed to New World screwworms and become infested. So that's important. So, just get a variety pack of maggots, if you will. Get your pupa, any of the adults. It can be dry. It can be an alcohol for the flies. If it's dry, sometimes it can dry out. If it's alcohol, sometimes you might not be able to pick up on some morphologic features. But if you're able to get those adult flies, please submit those as well. You can put those they can be unsterile. None of this is sterile, so you can put them in the tubes that you have. You can get just plain red top tubes. You can put them in there. You can put them in plastic tubes. They just need to be able to seal well, because you're going to want to put either ethanol or isopropyl alcohol in there, but don't fill it full, because remember, when it's being shipped, then that fluid's going to expand and you don't want it to leak out in the box. So, just make sure that you cover those, maybe get it about 60 or 70% full. You don't want to fill it to the top. Do not use formalin. That makes it very hard to identify the species that it is. Use gloves and forceps. And then if you can, take photos. It's a good idea to have. Try and get good quality pictures if you can, even video if you would like. And then this is the form that you would submit if you have a potential infestation. This is called a 538 form. And again, you've got the QR code there. And then the FAD number that you would have gotten from the state veterinarian or APHIS, you put that in block 31. Please write legibly. You can use the electronic forms. Just either write or type using permanent ink or pencil in case anything smears in there, and just fill in the animal information. In your packaging, like we said, put, whether there's ethanol or isopropyl alcohol covering the specimens. No more than 30 mLs per package, please. No formalin. And then label your vials with permanent ink, and each animal gets their own vial. Secondary packaging, if you would just put those tubes into a Ziploc bag with something like paper towels or adsorbents. And then finally, the outer package or the cardboard box. It just needs to be big enough. No envelopes, please. No FedEx boxes. And it can withstand stackability. There's specs for boxes if you didn't know. So this is just an example, just a sturdy cardboard box, including the paperwork in the outside layer, so that if anything leaks, it does not leak on that submission form. And then finally, shipping it to our National Veterinary Services Laboratory in Ames, Iowa. You can see the address there. And then before you ship that, do please email the NVSL lab. You can see the email address there. And your subject line, please put suspected screwworm. You can email photos if you have them. If not, it's not required. And then it needs to be overnighted, or priority 1 if you're doing a foreign animal disease investigation, so that we can get there as quickly as possible. We want to identify it and act as quickly as possible. And then that priority of shipment should be determined in consultation with your APHIS or your SAHO. In some cases, they may deploy a foreign animal disease diagnostician, which is either a USDA or a state veterinary medical officer trained for foreign animal diseases. And then the entomologist will give an informal report within 24 hours and an official report within 3 days. All right, and with that, I'm going to turn this over to Dr. Colonius to talk a little bit about the therapeutics. I'm going to stop sharing so we can share that. And then at the very end, I've just got some outreach materials for you guys.
Great, thanks. And USDA, are y'all able to project the slides back up?
Yes.
So,
our lens is window. So sorry about that. Okay, there we go.
All right, so I'm going to talk through a little bit about where we are for animal drugs for New World screwworm. Next slide. So FDA Center for Veterinary Medicine, if you're not aware of us, we regulate animal drugs and devices. We have human and animal food safety responsibilities, and we also regulate animal biotechnologies. We are part of the U.S. Food and Drug Administration, which is part of the broader U.S. Department of Health and Human Services. But I'm really going to focus today on the animal drug section. And important to note that there are some products that will be EPA regulated or registered that are not considered animal drugs because they're not systemically absorbed. So some of the fly sprays for cattle. So just want to clarify that Animal drugs are one important tool in the toolbox, but there's certainly other countermeasures that may be regulated by EPA that veterinarians should consider when they think about the toolbox they need for this threat. Next slide. So given how well USDA sterile fly program worked, and as you heard, screwworm's been eradicated from the United States since 1966. There are no approved FDA products specific to treating, preventing, or controlling New World screwworm, since we have not had this pest for decades. But we know that the threat is increasing, and we hope that it does not get here. And certainly we hope if it does get here, it's a very limited incursion that's stamped out quickly. But we want to make sure that veterinarians, producers, and really particularly state and federal animal health officials have the animal drugs that they need in their toolbox, if we do have to battle a New World screwworm incursion, and that it's, a part of the coordinated U.S. response to this threat. And I think the unfortunate thing is that the animal drug options for New World screwworm are not one size fits all. We're certainly thinking through a number of different products, a number of different species, a number of different husbandry practices. And it certainly gets a little complicated given how promiscuous this fly is, that you really got to think across wildlife, companion animals, or small ruminants, our cattle, our pigs, and really the whole spectrum of species that could be, affected by this pest. Next slide. So one of the things I want to leave you with is we've launched a web page that we're building out with information. We've got a QR code here, a link here as well. Would really encourage veterinarians to, keep abreast of our web page. It's absolutely going to be an evolving web page. What's on there today may not be what's on there a week from now, a month from now, as we work at full speed to bring additional tools in the toolbox to address New World screwworm. So hopefully this QR code works for folks. And if not, if you Google animal drugs for New World screwworm, FDA, you should be able to find the page pretty easily. Next slide. So we've been talking with various partners, our state animal health officials, our veterinary colleagues, some of our animal producer groups, to really get our hands around what is the animal drug needs for New World screwworm. What species are we particularly worried about in places like Texas, where we have a greater risk of an incursion? What's the practicality that different species face? Dealing with wild deer is certainly different than dealing with cattle and different than dealing with cats and dogs. For food producing animals, we're thinking through, the food safety risk, and like any anti-parasitic and an integrated parasite management program, that there are resistant concerns with this pest, as there are with many parasites if tools are overused. Next slide.
Sorry.
No worries.
Okay, there we go.
So the steps we've been taking is we've looked at foreign markets where this pest is endemic to understand, what are animal drugs that may be authorized overseas that are not here. We've identified a few of those. For example, there are some topical combination products overseas that are meant to treat wounds that may contain both an antiparasitic and an antimicrobial. We've been also looking through the drugs that are approved here for different indications, things like ivermectin, dormectin, moxidectin, and to what extent there's literature that may support their use against screwworm. And we're working with drug sponsors and like I said, our state and federal partners to really understand what are the options out there, how can we make these tools available, and what's the best path to make these tools available so they're in the toolbox if and when this thing arrives. Next slide. So if this thing arrives tomorrow, which again, we hope it doesn't, I think one of the most important tools for veterinarians will be extra label use of animal drugs, which it was spelled out under the Animal Medicinal Drug Use Clarification Act, or AMDUCA, of 1994. And this statute gives veterinarians fairly broad ability to allow the extra label use of drugs in animal when there's not a specific approval for a diagnosis. But it does come with various strictures. Producers need to talk to a veterinarian about extra label use. A veterinarian needs to use their judgment based on what's going on. If there's extra label use in food producing animals, that veterinarian needs to, ensure that there's a specified meat, milk, egg, or other food withdrawal time prescribed for that extra label use. And there are resources for that, like the Food Animal Residue Avoidance Database, particularly if that use is at a different dose or frequency than what a product may be otherwise approved for a different indication. And there are some restrictions. So, for example, the extra label use of medicated feed is not permitted under statute. And we know there's been interest in different administration forms, like different options for administering antiparasitics, and we actually don't have any currently approved medicated feeds for cattle or for wildlife containing a macrocytic lactone for even other indications at all. Next slide. So one of the resources we launched on our webpage, which I would encourage particularly this audience, veterinarians, to go look at, is to help veterinarians be prepared if we do need to make extra label use decisions for products that are currently approved in the US for indications other than screwworm, for which extra label use is legal, which would be generally most any of these products other than medicated feeds. We've launched a table that contains a list of FDA-approved anti-parasitic animal drugs, and for which there's a literature that describes their use in either the prevention, say, treating animal around a husbandry practice that is going to introduce a wound, or the treatment of myiasis with New World Screwworm. So hopefully this is a helpful resource. We've got some products where there's literature for cattle, for swine, for other ruminants, and a number of products for which there's literature in dogs and cats. These range from macrocytic lactones like ivermectin and doramectin. We've got nidinpyram, which is a neonicotinoid, and we've got some of our isoxazoline products. Macrocytic lactones and isoxazolines generally work on glutamate or GABA-gated chloride channels in nerve and muscle cells. That leads to these invertebrates being paralyzed. And neonicotinoids generally work on nicotinic channels. Because they lead to the paralyzation and death of these larvae, it's important for veterinarians to still think through surgical debridement, treating secondary infections, wound care, etc., in addition to these antiparasitic products. Next slide. But we recognize that solely relying on extra label use is maybe not enough of tools in the toolbox. So we are working diligently with sponsors to get additional products approved or authorized on the market. So that could include potentially emergency use authorization. It could include a conditional approval, which is where we approve a product conditionally that hasn't met a full effectiveness standard. It could include supplemental approvals. So say that's a current product that just doesn't have an indication for screwworm where a supplemental indication is approved, and it could include full approvals. And we are looking both at products that are already here for which there's data to support adding a screwworm supplementary approval. And we're also looking at products that are not on the market, whether those are products marketed overseas or products that don't exist today. And we're prepared to work really closely with our federal and state animal health officials. Our goal is to get as many products as possible to a full approval or a conditional approval, which we would consider gold medal. But certainly we're going to be looking at emergency tools, particularly if this arrives sooner rather than later. And we've got good experience in working with our USDA partners and our state animal health officials. And if we need to, we will be using emergency tools, any tool we have to bring in additional products. Those, depending on the situation, the incursion, those may be deployed through limited zones, but we want to make sure that our state and federal animal health officials have the tools in their toolbox they need if we get an incursion of screwworm in this country. Next slide. And I think we've got one more slide after this. So I think the take-home message for veterinarians is right now, no products, no animal drugs are specifically approved for screwworm. There are a number of products that veterinarians can prescribe or order the use of extra labelly. We've got some really good resources on that. And we are hoping in the weeks and months ahead that we can start to build out the toolbox with products that have specific approvals or authorizations for screwworm. And we'll be prepared to work with our USDA and state animal health officials to bring in products under potentially emergency tools, depending on what's needed to address any potential incursion. So please visit our website. We've got some of these good resources here now, and we will continue to build these websites out as we hopefully add additional tools to the toolbox for veterinarians and our state and federal partners. Thanks.
Thank you so much. Okay, now just in wrapping things up, we've just got a few outreach materials I want to share. So if you, again, want to get your cell phones ready, that's kind of how we're communicating a lot of this. And again, just as a reminder, this is all recorded and we'll make the slides available. So if you did not get the QR codes, they will be available also. On our publicly facing page, you see the link there at the bottom as well as the QR code. So this is where we put any of our publicly available material. There are lots of different sections in here that you can click on, including the outbreak maps, the sterile insect information sheet. Another page, if you keep scrolling further down that page, we have different tabs, how to prevent the disease. It's got U.S. dog entry permit requirements, U.S. labeled pesticides, CDC, fact sheet links, information on the sterile insects. We've got our economic analysis here. Just giving you a minute for that if you need it. And we do have brochures available in both English and Spanish. These are very nice, colorful. These were updated, I believe, the beginning of this year. But that QR code, this will take you to the link where you can download and print these brochures if you would like to. So it kind of goes through the whole life cycle, how we prevent it, what to look for. So it's very helpful. It's also got a QR code on there that'll also link them back to our page. It's attention for accredited veterinarians. So this is good outreach for accredited vets. We've got some pest alert fact sheets. This is good to kind of share within your community as well. Has a lot of details on the flies, the distribution, hosts, and impacts, and where you can learn more. And we've got fact sheets on sterile insect technique. That's kind of always interesting if you want to go back and read some more on that as well. And then our other resources, we have these pest alerts and brochures, as I mentioned before. We have links for reporting to report signs of animal disease. You see kind of that yellow box right there in the middle. That also tells you where you can find an accredited veterinarian, list of reportable animal diseases, SOPs for dog and animal detections. I failed to mention before too, so we have an outstanding New World Screwworm veterinary accreditation module. You do not have to be an accredited vet to look at that. You get credit if you do, but it's an outstanding module on New World Screwworm. You can get more information on that. So if you see there where it says guidance for veterinarians and animal health officials there towards the bottom, that's what you open up here. And so this has got a detailed standard operating procedure on sample submission, treatment, movement controls, and cleaning and disinfection. And that's just a one-pager there. For anyone that's listening that's a foreign animal disease diagnostician, we've also got a 3-page brochure that kind of gives you more information on collecting those samples for an FAD investigation. And then we also have a 1-pager on how to handle a suspect case. So this QR code is the same as the other. It goes to that New World Screwworm homepage. We have a Be Aware and Prepare. This is a really good 1-pager for veterinarians if you want to make posters of it, put it in email newsletters, or just post it there in your clinic. This is a really good 1-pager for your clients too. It shows a good picture of the eggs, the larva, and the fly all around there. It also has the links down there so that you can find your state animal health official and area veterinarian in charge for reporting. And then this is just the description for foreign animal disease diagnosticians, kind of step-by-step on your submissions for those. And then just kind of a reiteration that we've got the Green Book published, and then we have a playbook in development, should be available later this fall. All right. So if you've got any questions, you see our email there. Please send questions. Reach out for help. We've got a huge team that's ready to help you when you need it.